Hi, I'm Dr. Karen Vieira, owner of the Med Writers, and I wanted to record this video for our new writers as they're onboarding. Um, we also do take in interns sometimes, so whether you're a new writer or an intern writer, same stuff applies. I just kind of wanted to have a chat, talk to you about what we do, and kind of welcome you to the team. But I think this video is applicable even if you're watching this, you've stumbled across it somehow and you're not onboarding with the med writers, but you're just trying to get into a career in medical writing. That's really what I'm going to talk about today. So I think for me, the most important thing was the mindset shift coming from a PhD research type position where everything is very protocol driven. I'd only ever in the lab written for a scientific and medical audience. I wrote grant proposals that were for getting funding to do research, and then once I had data, I wrote up the research to get it published in a journal, and that really was the focus. And then I did some presentations to present my research, whether it was journal club or our lab meetings or bigger joint lab meetings, or presenting at conferences, things like that. So I'd written posters and PowerPoint presentations. But again, for a medical and scientific audience, maybe I took it down a notch, because maybe they didn't work on the exact genes that I worked on, and they didn't know about hemoglobinopathies, which was what I was working on when I was doing my doctorate. But the point was, I hadn't been exposed to many other areas of writing. I didn't even know they existed. So the Med Writers, we are a group of mainly PhD research scientists, some medical doctors that write for a variety of different types of clients. We write for, yes, academic type clients, but so many more, big pharma. So we're talking all the, big pharma names that we're talking smaller kind of biotech companies, whether they're startup or medium size, maybe not big Fortune 500 type companies, but biotech companies are up and coming. Um, Supplement companies who are selling dietary supplements, any kind of health and wellness. We work for anything healthcare, so all the way from giant healthcare systems all the way down to an individual doctor office or chiropractic office or whatever, or a small group of clinics. And the types of projects that we do, really, I put into two buckets. It's marketing writing and then it's technical writing. So technical writing stuff you guys are familiar with, or guys and gals, writing manuscripts, so writing grant proposals and that more kind of technical stuff where you're trying to publish something and convey data and that type of thing. But the marketing writing, I find, is the hardest shift for scientists, and this is where scientists are most needed right now, because when somebody isn't feeling well and they go to the almighty Google searching for answers, which is what our modern world does, um, we want them to find credible information that's based on research studies that we pulled from PubMed, right? Like good studies that are indexed somewhere. That is not always what's being found and what's being published. And so that's why I said there's really a need for us to come into that space, but that's the hardest space, in my opinion, for us to move into, because it's a complete shift, mindset shift, coming from that very protocol driven work that we're used to, very structured, very regimented, and you want to use as much technical jargon and really show your knowledge. That's what we're used to. And then coming into marketing writing is like, you need to be able to bring it down several notches so that somebody who maybe only took high school science can understand what you're saying. It's actionable for them. They really understand why it relates to them and the specific problem they may be having. So it involves getting in the other person's shoes and really understanding who would be reading this, Why would they be reading it? What are the issues they're dealing with? And how can I appeal to them? So it's a completely different set of tools than what we're used to using in scientific writing. But it's the most needed because there's so many companies out there that want to publish good, credible information on their websites, on their blogs, on their social media to, yes, attract customers. Not every single piece is going to be selling, selling, selling. Sometimes it's educating, or sometimes it is educating with the end of, so buy our product or buy our service or sign up for a service. So that's the real mindset shift that we deal with. And I think a lot of scientists and doctors are not used to that. And they jump into the company saying, hey, I want to try out medical writing, or I've done some writing and I want a job as a medical writer. It's an awesome job. It's flexible in terms of work from home, remote, flexible hours. It's an awesome job, especially if you're trying to add it on as a side income, or if you're just trying it out to see if a job in this industry is even for you. It's fantastic. But I just want to make sure you come in and understand it's a mindset shift. It's coming from a place where everything was always so well defined. Medicine and research science is a very well defined area, and then you come into a place where things are not so well defined. We work with a lot of small business clients, and they're trying to sell their product or service in the healthcare or health and wellness industry, and they may not really know what they need written. They can't articulate it. They just can say, hey, here's my product or here's my service. Can you write an article or can you write a white paper about X? And that's it. And they just kind of leave you there with that. And then it's up to you to dig in and ask the question. So we try to, when we do the sales conversation with a new client that wants, or for a new project, we try to get who's the audience, who are you envisioning is going to read this, where are you publishing it, what length are you going for? And the length is not hard and fast unless you're in, a publication that has a very specific word count or limit, but we need to get a range from them. So when we tell you it needs to be 1,000 words, it doesn't mean it can't be 900 words or it can't be 1,100 words. It just means this is, we just try to get an approximate range for you so that you have something to work with. Otherwise you just write and you're like, is it long enough? Am I done? So obviously write the best piece you can. The word limit is just a guideline. But these are the types of things we try to tease out from the client, extract that information to give to you. But we're not going to get everything until you jump in and actually see what they provided and see what's needed to get this work done. That's when the questions really arise. So when we hand you a project, it doesn't mean, hey, tag, you're it. It means, hey, jump in, ask questions. What do you need? What else did we not think about? Just so you know, our sales person is not a PhD scientist or an MD. So she's doing the best she can in terms of getting the information from the client to give to you. She's been doing this a long time, so she is an honorary, I guess, PhD, I call her. But, cut us some slack. She's doing the best she can. So if stuff is missing, if it feels very, well, what's the goal here? What's this? Ask those questions. Absolutely. But I also encourage you to extrapolate. This is a chance to use your problem solving and your kind of strategic thinking that you learned in the PhD program or medical school, which is, connect the dots and say, okay, here's the information I was given. How do I put that together and make sense? If I was this client, what do they really need? Sometimes we know better than they do what they need, what the piece that we're writing needs to articulate. Let me just go through and tell you a few things in terms of the types of projects we take on, because we take on so many different types of projects. I'm pulling up a list here so that I can show you or tell you. So the types of things we write. So I'm going to start with, all right, books, ebooks, meeting, conference posters, PowerPoints, any kind of proposal, whether it's for a contract or for a grant. And the full application, sometimes we're helping companies with their full grant application, not just the proposal part, but all of the filling out and all that. Protocols, sometimes companies want us to help develop a protocol, maybe for a study. We've done a lot of protocols for, small dietary supplement companies that really want to test their product and show that it works in a clinical study. Any kind of articles, whether it's for the internet, for magazines, so print or online, blog posts, tons of them. PowerPoint presentations, I mentioned already. Sales letters, if you go to a website and you read this kind of big long letter explaining to you why you should buy a product. And they also do print sales letters. We've done some of those too. Reports, white papers, business plans we've done for some small companies in the healthcare and biotech space. They're looking for investors, looking to grow, and need help writing up their business plan. So many things. So I don't want to take up all the time talking about that, but just kind of giving you an idea of the types of work we do, the types of clients that we have. I guess there's a few that I left out that I should include. We do ad copy too. We do product descriptions. Sometimes clients want to sell on Amazon. We do Amazon product descriptions, brochures, booklets, outreach for clinical trials, trying to recruit participants to, get screened for a clinical trial. We do email templates. Some companies are trying to send out emails either for education or for prospective customers, and we do create those templates for them. Flyers, guides, information kits. Landing pages are a type of website. We've helped people with their LinkedIn profiles and other social media profiles. Product sheets, press releases, Q&A, you'll see on some companies' websites like FAQs, that kind of thing. Social media posts, we do, a ton of those. Twitter, Facebook, LinkedIn. I've done a few Instagram, but not many. Video scripts. A lot of clients want to make videos talking about their products or services, and they need a script for it. Webinars. We've written the content for webinars. Sometimes we actually teach the webinars for the clients. Abstracts, more in the technical writing space, things that you'd be more comfortable with. Biographies, claims substantiation for dietary supplement products. They're saying that product does something, they have to substantiate why they're saying that with studies. Courses, we do all types of CMEs. So if you're a doctor, you've got to continue, getting educated. So you got to continue taking those medical education credits. We write lots of those. Fact sheets, obviously papers to publish in medical journals, tons and tons of those types of manuscripts. One that's gotten kind of popular is publication roundups. Different entities want to round up, here's all the papers that were published recently by or team or by or researchers or by anybody working on this specific gene, that kind of thing. So that gives you an idea. Anything can come at you. And so I've heard from a lot of people that have worked here or some that are still working here that it's been fantastic because of the diversity of the types of projects. Try things out and let us know what you like, because you're not going to like everything and you're not going to be good at everything. I specifically, when I started writing, found that I actually love writing for a lay audience. I call it translating difficult concepts into something that anybody can understand. So I love taking my ability to read, hardcore science, these in-depth studies about whatever gene and this, upregulated transcription and this, the average person isn't gonna be able to read that and understand it, but I like to be able to read it and then be able to explain it to somebody else who has no science background in simple language in a way they understand and is actionable. They can put something into action in their life. Not everybody likes that. Some people on our team love just writing papers to publish in journals or writing grant proposals, you know, more for a medical audience. So you got to find your spot, find your niche, try lots of things, see what you're good at. And communication is key. Ask lots of questions. Reach out to me, reach out to anybody else on the team. Ask us a ton of questions. That's what we're here for. We will hold your hand and guide you through the process of being a medical writer with us. But we can't do it without your help. And please join our writers' calls. Our writers get together. Currently, we do it Fridays at, I want to say, 11:30. It's just a quick half an hour. You jump in with your questions, comments. We have a little bit of chit chat, and then usually I present some topic to help us become better writers. So join us. That's part of the education as well. And you know, use all the resources. We have training available. We have you know, those writers calls to lean on each other, and sometimes we do team building activities and things like that. So join in as much as you can. Ask questions, reach out, call me, email me, let's have a conversation. But good luck and yay, congratulations. Here you are, and I think you'll like it. I love it. I've been a medical writer now for 15 years, and it's definitely something I enjoy very much. All right, I've been rambling long enough. So that's it. Adios. Bye-bye.